meetings over the years, and I very much appreciate you being here. Throughout my campaign, I pledged to focus on improving conditions for African American citizens. This means more to me than anybody would understand or know. Every American child has a right to grow up in a safe community, to attend great schools, to graduate with access to high-paying jobs. America has spent trillions and trillions of dollars overseas. I guess I heard just recently in the Middle East we had spent, as of about 2 months ago, $6 trillion. $6 trillion. And you know where we are over there. While neglecting the fate of American children in cities like Baltimore and Chicago and Detroit, African American citizens have given so much to this country. They fought in every war since the Revolution, and they fought hard. They've lifted up the conscience of our nation in the march toward civil rights, enriched the soul of America and their faith and courage, and they've advanced our country in the fields of science, arts, and medicine. Elijah Cummings, who was here about 2 weeks ago, who I happen to think is a terrific man. I don't know if he'll say that about me, but I will tell you, I really liked him a lot. And we were talking about drugs and prescription drugs and the costs. And you go to Europe, you go to Canada, you go to other countries, and you buy them for a fraction of what you pay in this country. And that's been a very big subject for him. And it's a subject for me that is very important. And we're going to either do it in healthcare, which I think we're going to do it in healthcare, or we're going to do it separately. But we're going to bid out drug prices, and we're going to try and have the lowest prices anywhere in the world, from really the highest. And that's not only the drugs, it's prescription drugs. But you go out to stores and you go even in any community, rich or poor community, and you look at the kind of drug prices that we're paying, and it's really unfair what's happened in our country. So we're going to be instituting a very, very strong bidding process. We'll probably need some legislation, but we're going to do it regardless. We have to do it. And we're going to get drug prices way down, way down. Some people think it's as important as the health care measure, because people are being ripped off when they need drugs. They need prescription drugs. And we're going to take care of that situation. So again, I very much appreciate you being here. It's a tremendous honor for me, and we're going to work on different things, and we're going to see if we can get a lot accomplished. And with that, let's get going. And thank you all very much. Appreciate it. Well, thank you very much. Appreciate you being here. It's a great honor. Very great honor. I want to thank Vice President Pence, Secretary Tom Price, and Administrator Seema Verma, who's done an incredible job, by the way, for all of the time and energy they've put into repairing and replacing Obamacare ahead of tomorrow's crucial vote, big vote tomorrow in the House. I want to especially thank Seema, the Administrator of the Centers for Medicare and Medicaid Services. A wonderful job she's doing, and definitely a complex job, but you have it under control, right? For hosting this very important meeting to discuss the vital role of women play in healthcare and the hardships inflicted on them by the Obamacare catastrophe. It's been bad. Administrator Seema Verma is playing the leading role for us in helping us to repeal and replace Obamacare. The doctors, nurses, and healthcare professionals here today represent the millions of women, millions and millions, who play a vital and indispensable role in Americans' health care. Unfortunately, Obamacare is making their lives so much more difficult, as we all know, and putting enormous barriers in the way of helping patients who we are going to help. We're going to get this thing done. We're going to get it figured out. It's a tough situation our country's been put in. It's not easy. Women doctors and healthcare leaders have changed the face of healthcare in America, saving and improving countless American lives. In 1965, only 9% of accepted medical school applicants were women. 9%. Last year, nearly 50% of newly accepted applicants were women. Congratulations. Good job. It's a good job. 38% of physicians and surgeons are women, and that number will continue to grow. That's a big victory for our society, big victory for America. I want to also thank all of the women nurses and healthcare aides for their incredible service and dedication to our country. What you do is remarkable. Unfortunately, Obamacare is making it much harder for all of the doctors, nurses, and healthcare professionals, men and women alike, to do their job. As insurers flee Obamacare's broken marketplace, and it is broken, it's broken badly, the insurance companies are fleeing. Millions of patients can no longer access the healthcare professionals they know and trust. That was keep your doctor, keep your plan, didn't work out that way. You don't get your doctor, you don't get your plan. So that is one of the more vital reasons why we must repeal Obamacare. It's one of the reasons why we're here today. So with that, I want to turn it over to Administrator Verma, and we'll start a meeting. Thank you very much. You can probably do it and stay for this little while, and then we'll clear out the room of talk. Okay? Go ahead.
Well, thank you, Mr. President. I appreciate it. This gentleman's been very supportive as I started my position at CMS, and I am very appreciative to be a part of this great healthcare team.
Thank you.
And thanks to all the women that came today. It's great to see so many strong professional women that are on the front lines of healthcare, so thanks again for coming today. You know, Obamacare has just been a broken promise. Instead of meaningful health care, we have higher costs, less choices, and more mandates. Right now, we have the government that's making decisions about our health care, not patients and not doctors. You know, as a mother and as a woman, the most important thing about my health care is being able to pick out the doctor that I feel comfortable with. But unfortunately, with Obamacare, we have less choices. You know, 1/3 of counties and 5 states only have one choice of health plan. And so that tells us we are not getting the choices that Americans deserve. And the problem is getting worse. We have even more insurers that are saying that they're going to leave the marketplace. And I think the other thing that concerns me is hearing from providers. Many providers are faced with dealing with regulations and mandates instead of focusing on high quality care and spending time with their patients. They are forced to deal with regulations. And I came to DC because I was so concerned about the direction our health care was going in because of Obamacare. I want to be a part of the solution. I'm very excited about the American Health Care Act. There's a vote on that tomorrow. I think this is an opportunity for us to finally get rid of Obamacare and move towards a system that's going to drive costs down, give Americans more choices, and put patients and doctors in control of their health care. So once again, thank you for coming today, and I look forward to hearing all the stories.
Thank you very much.
Administrator Seema Verma, and also that event was attended by the Vice President and the Health and Human Services Secretary, Dr. Tom Price. Healthcare professionals have seen the challenges of implementing Obamacare firsthand. They're a valuable asset to the President and his team as we continue to consider and enact policies like the American Health Care Act that will make healthcare more accessible and affordable for everyone. The women who are at the roundtable today represent the physicians, nurses, pharmacists, and administrators who make sure that people around the country receive the necessary preventative and life-saving care that they need every day. The doctors who attend to the patients in the family practices, emergency rooms, and clinics, and those who support them on the administrative and technical sides are one of our country's most treasured resources. With the passage of the American Health Care Act and the rest of the President's health care reform agenda, everyone, regardless of their financial situation, will be able to take full advantage of this resource. That's why at last count, over 40 major associations have expressed their support for the American Health Care Act, with several of them including the U.S. Chamber, the National Federation of Independent Businesses, and just today the National Taxpayers Union calling it a key vote. Following his appearance at the panel, the President and his Legislative Affairs team hosted several members of the House of Representatives for another meeting on the American Health Care Act. The President acknowledged, as he has before, that the AHCA is only one step in the larger process of fixing the broken healthcare system created by Obamacare, but it's an essential first step. Undoing and fixing all of the misguided policies is going to require a holistic, multi-step process. And that's why the President and his team are fully committed to maintaining an open line of communication with Capitol Hill leadership throughout this entire process. Throughout the weeks since the ACH was first introduced, they have been meeting with Republican members from across the political spectrum, many of them who we've seen move from no to yes as they learn more about the legislation and amendments that have been adopted. Continued coordination between administrative and legislative actions will ensure that our new healthcare system is effective and efficient. This afternoon, the President will meet with the Congressional Black Caucus's Executive Committee. The President has brought in and will continue to hear from representatives of all interests as he continues to note that he is the President of all Americans. Diversity makes our nation strong, and it also means that we don't necessarily agree on every policy item, but that we continue to have a dialogue towards productive policies that help America move forward. The President looks forward to discussing the CBC's policy priorities and finding ways that they can work together where those priorities align. This evening, the President will have dinner with Secretary of State Tillerson. Today, at the State Department, Secretary Tillerson hosted the foreign ministers and senior leaders of the global coalition working to defeat ISIS for the first meeting of the full coalition of 68 members since December of 2014. This meeting follows up on the Defense Ministerial Secretary Mattis hosted last month in Brussels. The coalition is united in the fight against ISIS, and this meeting seeks to accelerate international efforts to defeat ISIS in the remaining areas it holds in Iraq and Syria, while maximizing pressure on its branches, affiliates, and networks. This meeting is part of our whole-of-government approach to defeating ISIS. The Trump administration will use all of the tools of national power in coordination with our international powers to cut off ISIS's funding, expand intelligence sharing, and deny ISIS geographic and online safe havens. Also today over on the Hill, Judge Gorsuch, in his second day of questioning by the Senate Judiciary Committee, during his nearly 12 hours of questioning yesterday, now at least I know how someone else feels, the judge continued to prove himself an enormously qualified jurist that Americans will all be proud to see on the Supreme Court. It's not surprising that Senate Democrats are failing to gain traction for any of their pot shots and opposition to Judge Gorsuch. There's simply not enough politicizing in the Senate Democrats can do to hide the fact that Judge Gorsuch is an immensely qualified and thoughtful jurist with a lifelong dedication to our Constitution. A few administrative notes before I take your question. Last night, we formally announced that the President will travel to Brussels for the May 25th meeting of NATO heads of state and government. During this meeting, the President looks forward to reaffirming our commitment to NATO and discussing critical issues to the alliance, especially allied responsibility sharing and NATO's role against the fight against terrorism. The President will also host NATO Secretary General Stoltenberg to the White House on April 12th. Today, the President declared major disaster exists in the state of Wyoming and ordered federal assistance to supplement state, tribal, and local recovery efforts in the areas affected by a severe winter storm and straight-line winds that occurred in February. We also announced that the President will deliver this year's commencement address at Liberty University on May 13th. The President's proud to call Liberty's President, Jerry Falwell, his wife Becky, and their entire family as friends, and looks forward to celebrating the success of this amazing graduating class on such a momentous occasion. Finally, a few minutes ago, many of you may have seen that the chairman of the House Intelligence Committee, Devin Nunes, gave remarks on the surveillance collected on individuals associated with the President. Let me quote him directly. Quote, I recently confirmed that on numerous occasions, the intelligence community incidentally collected information about U.S. citizens involved in the Trump transition. Details about U.S. persons associated with the incoming administration, details with little or no apparent foreign intelligence value, were widely disseminated in the intelligence community reporting. And third, I have confirmed that additional names of Trump transition team members were unmasked. And fourth, and finally, I want to be clear, none of this surveillance was related to Russia or the investigation of Russian activities or the Trump team. My understanding is that Chairman Nunes is coming to the White House later to brief the President on this development, and we will have a readout for that meeting once it occurs. With that, I'd be glad to take your questions. Mara.
Two questions, one on Nunes and then healthcare. Is your understanding that this, none of these unmasked names were leaked?
I don't know. I literally read the statement, or heard the statement, came out and briefed it. It was wrapping up as we were beginning this.
Okay. Today, in the pool spray, the President said keep your doctor, keep your plan, didn't work out that way, you didn't get your doctor, you don't get your plan, this is one of the reasons we have to repeal Obamacare. Is the president assuring people who currently like their plan or like their doctor that under the American Health Care Act they can keep their doctor and their plan?
Well, that's the hope. And what I mean by that is not to be cute, but last time they were promised something that didn't turn out. I can't promise something that a doctor stays in a plan or a plan stays there. But that's a bit different. We understand that we're letting market forces come into play here. Competition, doctors can change what insurances they take, plans can come in and out of markets. What I think we can be assured of is a couple things. One is that currently, under Obamacare, premiums are set to continue to skyrocket. We've seen an average of 25%. We've noted before in Arizona they've gone up 116%. I think there's no question that the additional competition and amendments that have been brought into this discussion will help lower the trajectory of that, number one. Number two is I think that there's going to see greater choice. So I think those are the things that we're willing to talk about being part of this plan, because you can't. Where they erred last time is went out and made promises that they couldn't keep. And I think that one of the problems that they did is that they tried to suppress market forces and competition, and instead of lowering costs and increasing choice, which is what they sought to do, it did the opposite. So that's where this is headed, and I think that's important. John.
Thanks so much, Sean. On the AHCA, Mark Meadows, who appears to be a firm no in terms of his opposition to the replacement bill, said that 25 members of the Freedom Caucus are opposed to this replacement bill. Do you dispute those numbers?
I'm not going to share our whip count. I know we saw Lou Barletta, who was a hard no, come out and say he's yes. Steve King, I believe, had been a no. He's a yes. Member by member, we're seeing tremendous support flow in our direction, and the count keeps getting stronger for us. So I'm not going to start to get into yes or no's, but I would just say that, former Congressman Mulvaney, now Director of OMB Mulvaney, who is a leader in that caucus, has been a very strong advocate of this policy. As you know, he's been up on the Hill talking to his former colleagues, assuring them of the effort and why the process has to go the way it does. But I'm optimistic in the sense of what we're seeing and the trajectory that this is going and the number of votes that are flowing our way, not the other way.
And on the confirmation hearing for Judge Neil Gorsuch, I have not seen any Democrat come out in support of Judge Gorsuch just yet. Do you anticipate that you'll get Democratic support on this particular nomination?
I hope and believe so. I think that there have been several that have been spoken very positively. I think he's been extremely impressive throughout this confirmation process.